Hello, everyone. I'm Dr. Yende. Let me ask you something. What if I told you there was a medication that has prevented millions of heart attacks, strokes, and cardiovascular deaths around the world? And yet it remains one of the most controversial drugs ever prescribed, a medication praised by cardiologists, questioned by influencers, feared by patients, and debated on social media every single day. I'm talking about statins. Few medications in modern medicine create this much confusion. Some people believe statins save lives, others think they're dangerous. Some refuse them outright, others take them without really understanding why. So who's right? Today we're going to separate science from myth. We'll look at what statins actually do, why they were developed, how they help prevent cardiovascular disease, what the real side effects are, and whether the concerns about statins are backed by evidence or fueled by misinformation. Because understanding statins means understanding one of the most important discoveries in preventive medicine. It's the real cause of most heart attacks. To understand statins, we first need to understand atherosclerosis. Because statins do not treat cholesterol, they treat risk. For decades, scientists searched for the main cause of heart attacks and strokes. Today, after thousands of studies in genetics, pathology, epidemiology, and clinical trials, one conclusion stands out above the rest. Atherosclerotic cardiovascular disease is mainly driven by particles that carry cholesterol through the bloodstream, specifically apolipoprotein B-containing lipoproteins, or ApoB particles. Every LDL particle contains ApoB. Every VLDL particle contains ApoB. Every remnant particle contains ApoB. Think of ApoB as the license plate. It tells us how many potentially harmful particles are circulating. And it's the number of these particles, not cholesterol concentration alone, that seems to matter most. The pipe analogy. Imagine your arteries as plumbing pipes. Every day, billions of ApoB-containing particles move through the bloodstream. Most pass through harmlessly. But when levels stay elevated for years, some of these particles slip into the arterial wall. Once trapped there, inflammation begins. Immune cells rush in. Plaque starts to form. Over decades, this process keeps building silently. No symptoms, no pain, no warning signs. Then one day, the plaque ruptures, a clot forms, and a heart attack happens. What looks sudden has often been developing for 30 or 40 years. Why statins changed cardiology forever. Before statins, doctors had very few options. They could recommend diet, encourage exercise, treat blood pressure, but there was no highly effective way to lower ApoB particles. Then statins came along, and everything changed. Statins block an enzyme called HMG-CoA reductase. This enzyme plays a key role in cholesterol production in the liver. When cholesterol production drops, the liver responds by pulling more LDL particles out of circulation. The result? Fewer ApoB particles, lower LDL cholesterol, slower plaque progression, lower cardiovascular risk. Simple, elegant, powerful. The evidence is extraordinary. One reason statins remain a cornerstone of preventive cardiology is the sheer amount of evidence behind them. Very few medications have been studied this extensively, hundreds of randomized controlled trials, millions of patients, decades of follow-up. And the findings are remarkably consistent. Lower ApoB, lower LDL, fewer heart attacks, fewer strokes, lower cardiovascular mortality. The relationship seems almost linear. The longer ApoB stays elevated, the higher the risk, the earlier it's lowered, the greater the benefit. Why people fear statins. Despite all this evidence, statins still cause a lot of concern. Why? Because side effects are real, but the fear around them is often greater than the reality. Let's go through the most common concerns. Myth number 1. Statins destroy your muscles. Many patients worry about muscle damage. Muscle symptoms are among the most commonly reported complaints. The reality is more complicated. Some people do experience muscle aches, muscle soreness, exercise intolerance. But severe muscle injury is extremely rare. In most cases, symptoms are mild and manageable, often adjusting the dose, the timing, or the specific statin can solve the problem. The key point is this: muscle symptoms should never be ignored, but they also should not automatically lead to stopping treatment. Myth number 2, statins destroy the liver. This myth has lasted for years, even though the evidence says otherwise. Mild liver enzyme elevations can happen, but serious liver injury from statins is extraordinarily uncommon. In fact, many people with fatty liver disease may actually benefit from statins, since cardiovascular disease is usually their bigger threat. Modern guidelines consider statins safe for most people with stable liver conditions. Myth number 3, your brain needs cholesterol. This argument sounds reasonable. The brain contains a lot of cholesterol, so lowering cholesterol must hurt cognition, right? Not necessarily. The brain makes most of its own cholesterol. Blood cholesterol and brain cholesterol are largely separate systems. Large clinical studies have generally not shown major cognitive harm from statin therapy. Some studies even suggest that by reducing vascular disease, statins may indirectly support long-term brain health and lower the risk of vascular dementia. The diabetes question, one concern, does deserve an honest discussion. Statins can slightly increase the risk of diabetes in some people. This effect appears real, but context matters. For patients at higher cardiovascular risk, the benefits usually outweigh that small increase in diabetes risk. This is especially true for people with previous heart attack, established coronary artery disease, history of stroke, or significantly elevated ApoB levels. Medicine is always about balancing risks and benefits. The question is never, does this medication have risks? Every medication has risks. The real question is, do the benefits outweigh the risks? For many cardiovascular patients, the answer is clearly yes. The biggest mistake in cholesterol management. Perhaps the biggest mistake people make is focusing only on cholesterol numbers. Health is more complex than that. Risk depends on genetics, blood pressure, smoking, diabetes, inflammation, metabolic health, exercise, sleep, body composition, family history, and increasingly advanced biomarkers like ApoB and lipoprotein A. The goal is not to chase a number. The goal is to lower lifetime cardiovascular risk. The future of lipid management. Statins are no longer the only option. Today we also have ezetimibe, PCSK9 inhibitors, inclisiran, bempedoic acid, combination therapies. These treatments allow for a more personalized approach. But statins remain the foundation. Why? Because they are effective, affordable, accessible, and supported by decades of evidence. The OXYZEN perspective. At OXYZEN Health Intelligence, we believe the future of cardiovascular prevention is not about waiting for disease to appear. It's about identifying risk early, measuring biology, tracking trends, understanding individual physiology, and stepping in before disaster strikes. Wearables can track heart rate variability, sleep, recovery, stress, but no wearable can remove plaque. No wearable can lower ApoB. No wearable can undo decades of elevated cardiovascular risk. That takes a combination of lifestyle, nutrition, exercise, sleep, and when appropriate, medication. The smartest approach is not choosing between lifestyle and medication. It's using every evidence-based tool available. Final thoughts. Statins are neither miracle drugs nor villains. They are tools, powerful tools. And like any tool, their value depends on how they're used. The science makes one thing very clear. Atherosclerosis is driven by ApoB-containing lipoproteins. Lowering those particles reduces risk. Statins remain one of the most effective ways to do that. So the question should not be, do statins work? The evidence already answers that. The better question is, do I personally have enough cardiovascular risk to benefit from them? And that's a conversation you should have with your doctor, using data, not fear, to guide the decision. Because prevention is always easier than recovery. A plaque prevented today is a heart attack avoided tomorrow. I'm Dr. Yende. This is OXYZEN Health Intelligence. And before I leave you with one final question, if a simple daily pill could reduce your lifetime risk of a heart attack by a significant amount, would you take it? Let us know in the comments below, and I'll see you in the next episode.